The medications that they used were Celebrex and Vioxx, I believe. Yep. COX-2 inhibitors, okay. The researchers in this article stated, don't forget that nonsteroidal anti-inflammatories like ibuprofen, the side effects of these medications have been well documented. Gastrointestinal toxicity by these drugs is the most common serious side effect in the industrialized world by drugs. It's the #1 side effect that we have to deal with is gastrointestinal toxicity from overuse of ibuprofen. Okay? So this study was looking at Celebrex and Vioxx versus chiropractic versus acupuncture. And it showed that chiropractic was 5 times better at relieving chronic, not acute now, chronic spinal pain than drugs, and was also better than acupuncture. Acupuncture, by the way, was also better than the drugs, but chiropractic was really at the top of the heap. What's neat about this is 1 year later, they studied these groups of people once again. After the research was over, and I believe it was 9 weeks of care, 9 weeks of chiropractic, 9 weeks of acupuncture, and 9 weeks of medication, they went back and they restudied these people a year later. Now keep in mind that these people were not under care for that year. So it was just a follow-up to see, did you have any lasting effects? Chiropractic was the only one that showed that it had long-term benefit in 5 of the 7 well-researched outcomes. I thought that that was pretty interesting. So chiropractic should be preserved as we move ahead because that's going to save us a lot of money. Not only are the side effects of chiropractic extremely low as compared to medication, it works much, much better. In this study, it was 5 times better. And it also had much better long-term outcomes where the long-term benefits from any benefits that the medication gave were gone. Now, this is a comment for the public. If you're the public watching this show and you do want to do 2 things. One is, if you want to see a program like this come into play in this country, then what you're going to have to do is contact your legislators and say, hey, I want you to watch Dr. Fuller's DVD, and we can certainly get you a copy, and we can work with the Woburn Public Media Center here to get copies out to people that are interested. So you can make sure that they watch that program. Number 2 is if you want to see chiropractic benefits preserved in any insurance care reform or Medicare and Medicaid, etc., then you need to also call or write your senators and representatives and even state legislatures to make sure that chiropractic benefits are preserved. One way that you can do that is go to this website. The website is called adjustthevote.org. Adjustthevote.org. And through this website, you can actually type out a note to your legislators and actually send it through the website. So it's a nice, easy way, quick way for you to go ahead and get your vote in to your legislators and make sure that chiropractic benefits are preserved to help save us money. The next comment, I'm going to go back into prevention for just a moment. How do we know that the program that I'm laying out here, which is clinics to educate people on better shopping habits, cooking healthy meals, getting regular exercise, daily exercise with all of these classes that are available to people, how is that going to help? Do we know this? Well, from the cardiovascular world, it's been very well established that if people eat a lot better and they get a lot more regular exercise, that they're going to reduce their chances of having cardiovascular events, whether it's heart attacks and strokes and clogged arteries and everything else. So if you don't have those events, guess what? You don't have to get treated for them, which costs a whole lot of money. Talking about prevention from a cancer standpoint, I wanted to mention a couple of articles to you. Article number 1. This was one of the best articles that I read, from the medical research. This was back in November of 1996. The journal is called Cancer Causes and Control. Harvard Report on Cancer Prevention. This is a supplement. This is a very thick document. It's 60 pages. And I'm going to go right to the conclusions of this study. Now, what this Harvard Report on Cancer Prevention did is it scoured all the existing research on cancer. And they wanted to come up with answering the question, what causes cancer? And if we know what causes it, how can we change it? This is what they came up with. The #1 cause of cancer is poor diet by a factor of 31%. So 31% of all cancers. Now they're talking about all cancers. Reproductive cancers, breast, colon, skin, everything. They just lumped it all together and said, what causes cancer? And they said, bad diet, 31%. So if we can improve people's diet, we can start taking a chunk of cancer out of the picture by preventing it, because it will never happen, and then we never have to treat it. The second most common cause of all of these cancers, obviously lung cancer being more so, would be smoking at 30%. Now, I did hear a disturbing piece of information this week on the news, and it was about high school smoking rates. High school smoking rates, meaning kids in high school that are smoking, has stayed, I think, about the same, or actually has gone up a little bit over the past several years. I think it was 1 in 6, something like that. And one of the problems with that is the tobacco companies that were sued, and they had that lawsuit that was against them. They had to funnel all this money through the federal and state governments back into the smoking cessation programs. With all of the economic downturn problems, the states have been taking that tobacco money, let's call it, the tobacco money, and putting it into their regular funding as opposed to these smoking cessation programs where a lot of the funding was supposed to go to. That's kind of a problem, because this study right here is saying that 30% of all cancers are caused by smoking. We're actually not seeing that continue its downward trend like it had done for a couple of decades. So we might need to revisit that, and if you are so interested, you might need to contact your legislators and say, hey, let's make sure we're not diverting those tobacco funds into other governmental agencies and programs. We want that to go back into the smoking cessation programs and smoking prevention programs, even more importantly. So following along these numbers now, 31% of all cancers are caused by bad diet, 30% of all cancers caused by smoking. That's 61% of all cancers caused by two things. Here's a third one, sedentary lifestyle, 5%. So that means if you don't exercise, you increase your risk of cancer by 5%. Let's add those numbers up. 31% bad diet, 30% smoking, 5% lack of exercise. You are now at 66% of all cancers. 2/3 of all cancers caused by three things. If you eat good things or not, back to my clinic program that I talk about here, if you smoke or not, or if you exercise or not. That's why I have this entire program set up here of these clinics that are going to teach people how to eat healthy, how to shop healthy, how to cook healthy, and then getting regular exercise. Maybe on these exercise classes that will also create jobs, they will not only have the exercise classes available that people can participate in right at those clinics, but we can actually show people that they can do their own exercise programs at home. Let's say that they can only go once a week to these clinics. Well, that's better than none at all. But maybe we can show them and supply them with information, whether it be the proper television shows for exercise programs, DVDs that they can take home, other exercise ideas and tapes and so on, or maybe there'll be a cable television channel that will be linked into this entire program. Maybe there'll be a couple of them. One will be on nutrition, the other one will be on the exercise programs available, so we can tie this all together and bringing you just a little bit closer. Even danafarber.org says that a healthy diet full of fruits and vegetables and beans strengthens your immune system and helps prevent cancer and helps you heal from cancer and cancer surgeries and chemotherapy after you had it. I pulled it right off their website. So they're saying diet is super important to help prevent cancer, to help get you through cancer and heal up afterwards, and help prevent returns of cancer. So now you can see the clinic program that I have here will focus on prevention, which we need more of. It's going to save us all money. We can fund it with federal stimulus money. It's going to create lots of jobs. I'm Dr. Scott Fuller, and this is Health Source.